Hello and welcome to a big milestone in the Bi-Monthly Breastfeeding Coalition's webinar. Today is our 50th session. I am Kinkini Banerjee, the Coalition's Relations Manager at USBC, and I'm so glad to have you join us for this special webinar. This series is jointly hosted by CDC's Division of Nutrition, Physical Activity and Obesity and by USBC. The webinars, referred to as the 222, are held on the second Tuesday of even-numbered months from 2 to 3 p.m. Eastern, and the purpose of the series is to bring together breastfeeding coalitions to share best practices and news and to network and collaborate on issues of national significance. We alternate the sessions, so we bring you one with a national focus followed by one that highlights a state's success. In October, we heard from the Michigan Breastfeeding Network about their landmark state legislation. Coalition members and breastfeeding advocates can join us for these free webinars. The announcements are sent through USBC's Coalition's announcement list. If you're not already on our mailing list, you could go to the quick link section on the right side of our homepage and click on the Sign Up for News and Action Alerts button to join our mailing list.
Through improved hospital maternity care policies and practices, through improved access to employer policies and practices to support breastfeeding, and improved access to peer and professional support in the community. Two guiding principles of our efforts are to support partnerships and communication to facilitate these efforts, and to prioritize areas and populations with low breastfeeding to reduce disparities and to achieve health equity. Next slide. CDC efforts to improve maternity care practice include the Maternity Practices in Infant Nutrition and Care Survey, which you're all familiar with, which was first administered in 2007. The MPINC survey is a biennial survey of all hospitals and birth centers that provide maternity care services. And it is an assessment of usual practice and usual care of healthy term infants and their healthy mothers. And there are 7 domains of care that are assessed that are listed here on this slide: labor and delivery, feeding of breastfed infants, breastfeeding assistance, contact between mother and infant, discharge care, staff training, and structural and organizational aspects of care. In 2014, we released slides of the 2013 survey. Next slide. And those results included a customized MPINC benchmark report for each of the nearly 2,700 participating birthing facilities in the U.S. The report provides a series of quality scores comparing each facility's practice to other practices in the United States, in the state in which the hospital is located, and compared to hospitals of similar size in the U.S. And really, this benchmark, this individualized report that goes out to every hospital has been our intervention to stimulate improved practice at facilities across the United States. Next slide. So in addition to those customized reports that go out to every state and that go out to every facility, we also have posted at cdc.gov/MPINC on our website national and state results of the 2013 MPINC survey. The actual state reports have been cleared at CDC, will soon be posted, but if you go into the web tables under the MPINC results, you'll see all the results by state as well as national results. Those are all available now. Next slide. CDC has also funded efforts to assist hospitals in becoming baby-friendly designated. And from 2012 through 2014, CDC funded the National Institute for Children's Health Quality to assist 89 hospitals in becoming baby-friendly through a breakthrough collaborative QI process. The work of this project, referred to as Best Fed Beginnings, is nearly complete with final designations planned by spring of 2015. Improvements in hospital practice and exclusive breastfeeding rates are shown on this slide. For example, improvements from 2012 to 2014 on skin-to-skin following vaginal and C-section deliveries, rooming in, and exclusive breastfeeding rates. Next slide. Starting in 2013, CDC also funded state public health actions to prevent and control diabetes, heart disease, obesity, and associated risk factors, and promote school health, otherwise known as 1305, which is a much easier name to remember. And so as part of 1305, 32 states received an enhanced award to work on breastfeeding, and in those 32 states, 22 elected to work on improving maternity care practices, 17 on employment, and 8 on parent professional support. Next slide. Now I just want to give you an overview of the projects that are now funded for 2014, and those include a 2015 MPINC survey, as well as a new project to provide technical assistance and training to enhance maternity care practices. The new projects kind of follow on the great work of Best Faith Beginnings, is a contract awarded to APT Associates to provide direct technical assistance to 100 hospitals to achieve baby friendly. Also, to continue to build state agency capacity for breastfeeding through ASTA, we were able to fund the other 18 states and Washington, D.C., those that were not funded by 1305 that you just saw on the previous slide, also working on those same strategies of maternity care, employment, and parent professional support. Also, we're able, through NACCHO, to fund community-based organizations to support breastfeeding mothers and African-American communities. They're focusing on increasing access to peer and professional support. And finally, we're able to fund to support innovative partnerships and communications through the United States Breastfeeding Committee. Next slide. And so now I just want to share some of the progress that we've been seeing over these recent years on breastfeeding, and really the progress that is a result of efforts funded by CDC, work that you're all doing, and efforts really that are taking place across the United States. Next slide. So, is there one slide back that we're missing? Oh, could have been. So there's one. So first of all, I'm just, in terms of MPINC and the domains of care we're looking at, we're seeing improvements across all domains of care from the MPINC survey from 2007 to 2013. Also seeing improvement when you go and look at individual practices. So these are on this slide here, these are 2 practices that we focused on in the 2013 breastfeeding report card, skin-to-skin contact between mother and newborn and rooming in. And you can just see those improvements in terms of skin-to-skin from 41% of facilities having ideal practice back in 2007 to 72% in 2013. Also in terms of rooming in from 31% back in 2007 to about 45% in 2013. Next slide. Also in terms of the percent of facilities giving discharge packs with formula to breastfeeding mothers, back in 2007, the MPINC survey showed that 73% of facilities were distributing these discharge packs with formula. In the most recent 2013 survey, it is now about 31% of facilities. So great progress because of efforts across the U.S. Next slide. In terms of baby-friendly designation, we have seen really just noteworthy increases in the percent of babies born at baby-friendly facilities across the United States. When we started monitoring back in 2007, it was less than 2% of births. We are now approaching 10%, 9.7 to be specific, from Kat Sheely, but even more, really just perfect for this call today and very exciting, there are now 222 facilities in the United States designated as baby-friendly. So it is very, just for this call, yes. And 100% of IHS hospitals are now designated as baby-friendly. And this is just great effort, and we thank everyone for all their work across the country. Next slide. I also want to share with you data that's not from a CDC source, but data from a national survey of employee benefits related to breastfeeding. And this survey has shown, improvements in access to lactation support for employed women. So you see increases in on-site lactation, increases in lactation support services, and some slight increases in bringing baby to work. The only place we're not seeing nationally a change is on paid maternity leave, but I do know that there are a few states that are doing some really great efforts on moving towards maternity leave. Next slide. This past July, we released the 8th annual breastfeeding report card. And this year, we focused on access to lactation support in the community. Next slide. We did note an increase in access to international breastfeeding certified lactation consultants as well as certified lactation counselors in the U.S. But it's clear that continued efforts are needed. We still have a long way to go. Our report also noted those geographic disparities in access across the U.S. Next slide. The 2014 breastfeeding report card as well as our website also released updated breastfeeding rates this past July. And for the first time ever, our rates were based on a dual-frame sample that included interviews conducted on landline and cellular telephones, really bringing us in line with other national surveys. And though you see that change, we went back and recalculated from 2009, which is where you see those open marks on the trend. But even more important are the increases that we're seeing in breastfeeding initiation, duration, and exclusivity across these years. Next slide, please. So while we have a lot of good news to report, we do want to highlight that disparities in breastfeeding continue to exist. And one specific disparity that we've put some effort on, among others, is that we do continue to see a lower percent of African American infants starting breastfeeding and breastfeeding at 6 and 12 months. We also see lower breastfeeding rates among infants from families with fewer financial resources and from families who live in rural communities. And so we will continue to prioritize communities and populations with lower breastfeeding rates in our funding and hope that, one of our outcomes is that we'll continue to see reductions in disparities. Next slide. Thank you. And the data and information, it can all be accessed at our website at cdc.gov/breastfeeding.
Great. Thank you so much, Kelly. That was terrific. And now our next speaker is we're going to hear feedback from our coalition leaders, and I'm absolutely thrilled to introduce Tina Cardarelli. Tina is the statewide breastfeeding coordinator for Indiana and has been a force in engaging community partnerships and leveraging local talent to build dynamic community environments for breastfeeding. She has spent over 2 decades of working in community breastfeeding in Massachusetts, Michigan, and Indiana. And Tina came to Indiana as the first breastfeeding coordinator when the role was created in 2008. She has a passion for working in communities to create successful, sustained coalition and identify partners and collaborators. During her tenure, the number of local coalitions in Indiana has grown exponentially. And Tina, we call her the coalitions coach extraordinaire, and she's been assisting other state coalitions to build and flex their coalition muscles. And with that, I'm going to turn it over to Tina. Tina, can you unmute your line, please?
Thanks, Kenny. I really appreciate your wonderful introduction. And let's get started with the next slide. So I like to describe myself as a grassroots organizer for breastfeeding, and so the last 7 years in Indiana I've really been about figuring out how to build our power base in our communities and in our states. And so today I'm going to just give you, I'm going to just give you a little cheat sheet of, or a little introduction into the work that I do, and hopefully spark some thoughts in the work that you do. So I often talk about how to build coalitions, how to sustain them, and why they matter. Today I'm really going to be focusing a little bit on building coalitions and why they matter. I really won't be touching on sustaining them. Next slide, please. So when we talk about building coalitions, we're really talking about building out our national coalition infrastructure. And I really love the idea of the USBC being like our mothership, and then all of the work that we've done in the state coalitions to shore them up and build them. But I happen to be a person who thinks that there's still a lot of work left to be done by deliberately building our coalitions out into our community very purposefully. And so we can just randomly hope that that we have this great state coalition and that something's happening in our community coalition, or we can actually take some deliberate action to go out there and build our power base. Next slide, please. So I want to just use the example of Indiana. I came to Indiana just about 7 years ago, and one of my first questions I asked was, how many local coalitions do we have? And nobody really knew. Some people said 5, 13, 8, like I don't know. So I had it out in my car to kind of figure out and take an inventory of what existed at that time. So anything that would have existed at that time pretty much just randomly popped up on its own. What I was really looking to do was to put a deliberate, strategic effort in place to go out and build coalitions in the communities. And so I wanted to inventory what exists, one of the things I might say here is that in my mind, and I could be wrong on this, I believe that coalitions come from 3 places. They either exist already, or they were built from the inside very organically, or someone comes from the outside and facilitates it. And a lot of the work that I did in Indiana, I went into communities and pretty much tried to facilitate something to get started so that that organic process would happen. Next slide, please. So a little bit more about the Indiana experience. It's really quite simple. It doesn't require a lot of expertise. And this was me in the early days, just kind of making cold calls into the community, asking what was going on with breastfeeding, if they had ever had a coalition, who knew who had done something in the community. And pretty much the tools of my success were a car, a pen, and a map that I got for free from the Indiana Toll Road that I wrote all over. And the next slide will show you that example. So next slide, please. So that's a little window into kind of this high-tech process of mapping out and identifying a state, what was going on, who's where our talents were in the state, and then kind of heading out into these communities to try to get something going on. Next slide, please. And so I'm happy today to show you that this is what the map looks like in Indiana. They are really bunnies that are multiplying now. We just started something that I don't even know. It's mind-boggling now. What we really have is an issue of how do we sustain all the infrastructure that we built. And just this fall, we've added 3 more coalitions to this map, which I think is going to be 47 coalitions. Some of them are in individual communities, and you can see by the arrows, some of them are, they encompass a few communities. And so I very proudly show you what can be done when you deliberately and strategically go out there and start your own little breastfeeding anthropological dig. Next slide, please. And so, many of you are listening to this call and you represent a state coalition, or you might represent a community that has or does not have a coalition. So you're coming from different places, but no matter where you are, I think that coalitions provide us, or like trying to figure out what's going on with breastfeeding in your community or in your larger area like your state. You pretty much want to figure out who's out there, what they're doing, what's going on. You want to ask a lot of questions. You want to listen to what the community tells you. And all along, you're building relationships, you're finding those connector people, and you're building on the ideas and efforts that already exist in your state. So you're not saying, oh, we should do this without any idea of what currently is existing. Next slide, please. So I'm not going to sugarcoat this. This is, this can be some tedious work. It can be long hours, lots of conversation, and it's, not for the faint of heart. And I think that's sometimes why people don't deliberately go out and build coalitions, because there was really not a lot to help me. I mean, the USBC has been amazing, but there was really not a lot to help me in the early years of doing this. Next slide, please. I've really come to understand that what's frightening about coalitions is that they're not an art and they're not a science. Sometimes you think you got it going and your coalition you turn around, your community coalition falls apart, or sometimes your state coalition's doing really, really well, and then all of a sudden, the next month it's like, what happened? And so there's really like this finesse to coalitions that I'm still a student of and trying to figure out. And as I figure it out, I love to share it with you. So they are difficult, they're exciting at the same time. Why do coalitions matter? For me, it's the most exciting work I've ever done in breastfeeding. There's an energy that exists around it. And the best representation I've ever seen of that is what the 19th century sociologist Durkheim calls group energy. He calls it collective effervescence. And I've really witnessed that in the community. Some people would, a more American term of that would be barn raising. But the ability to do things as a group that we could never, ever accomplish individually, and that's really, really powerful when you're out there in the community and you see what these coalitions can accomplish. A person that I admire her work, Fran Butterfoss, that works in coalitions. She actually has her PhD in coalitions. She's written a couple of textbooks. She said one of the best reasons coalitions exist is because they provide a dynamic, innovative, experimental experience. And I often say to the people in my coalitions, this is not a second job. These are book clubs for people who care about breastfeeding. This is, this should be, challenging and fun at the same time. Next slide, please. So, my grandmother used to say, many hands make light work, and that is really what I've witnessed and been a party to, and the work that I've done in coalitions. Next slide, please. And so, and so they the coalitions give us the ability the freedom to color outside the lines, to think outside the box, if you will. And like I just said, I have to often remind people everywhere I go in the state that just start to make these coalitions incredibly tedious, that this is not a second job. So, to have fun with it and to do things that you cannot do within maybe like your 40-hour-a-week job that you do. Next slide, please. So coalitions have taught me a lot of lessons, and that could be, an educational thing that could go on for a day for me. But to keep it simple, when I first started this job, we looked at a lot of grants and a lot of opportunities to do work, and my first question was, well, who would do the work? So we would bring money in, or we would get an opportunity, but who would do the work? And so I believe that you need to create your workforce at the ready. You don't have to go put out an RFP to see, well, who's out there that could do this work? It's like you already know their name, you form relationships, and they're at the ready to work. So you just need to bring resources and opportunity to them. They also, I've noticed in the time I've been involved, that I see trends very early in the community and emerging issues that almost sometimes don't come to the national attention until that seed started in the community. And so they really are very informative to us. They show us what works and what doesn't, and they can be really like the original pilot study. Where you can just try something in a coalition and say, nah, bad idea, great idea, and then roll it out from there. We learn how to customize our initiatives and fine-tune them, and most importantly, we discover and build on talents and ideas that already exist out there. And if you haven't done a lot of coalition building in your local area, or really built out your state, I encourage you to do that because the talent and ideas are mind-boggling. I mean, it's just overwhelming what exists in your state. And they also, you know, for those of us who do this kind of work, they really teach and inspire the work that we do. I do want to say that when you work with coalitions, generally the change is very rapid, and that's exciting to me. And in most of our jobs, you know, the pace is slower. So I love the exciting pace of coalition work. Next slide, please. And so I hope that my tiny little taste of the work that I do will get you excited about the opportunities that coalitions represent to do authentic work that represents the state and local communities. And if you, you know, I think that coalitions are like represent the best vehicle for the change that you want to see in the world. And then I could not miss the opportunity to put my grandson in my presentation. So with that said, that's just a little bit about the work we do, and I hope that you take the enthusiasm I have for my work, ponder it a bit, and see what you can do to build out your coalitions or you know, improve your coalition infrastructure. And I thank you for your time.
Thank you, Tina. That was terrific. And, you know, there are so many nuggets of wisdom in there, but like you said, really having our ears to the ground and being, when we are starting a coalition, when we are starting anything, to look at what is already there in the community and build from that, and making meetings fun. You really do exemplify that. So thank you again. And our next speaker is Brenda Bandy from the Kansas Breastfeeding Coalition. Brenda is the coalition rep for the Mountain Plains region. She's a founding member and past president of the Kansas Breastfeeding Coalition, where she currently coordinates the Building Local Breastfeeding Coalitions project involving 34 communities in Kansas. Brenda has helped the KBC obtain several grants and contracts addressing child care provider education, coalition building, employer solutions for workplace lactation support, and the continuity of breastfeeding care. She is the program director of the Kansas Business Case for Breastfeeding through the Kansas Coalition. She was instrumental in passing Kansas public breastfeeding law in 2005. And Brenda is an IBCLC and active member of the High Five for Mom and Baby Advisory Committee, a statewide maternity care improvement program in her state. She is also the chair of the La Leche League division of the Kansas state, and is a La Leche League member rep to the USBC, and she also serves on our board and chairs the advocacy committee. Brenda functions in one mode only. That's 150% commitment, and there is no downside to Brenda's involvement in anything. She's there over and above what she has to do, and we are so grateful for so many gifts that she brings in her various roles at USBC. And with that, I'm going to turn it over to Brenda. Welcome, Brenda.
Thank you. As Tina said, I am really honored to be on this panel and to share my reflections on what these webinars and the following regional calls after the webinars, what they've meant to me personally as well as to the Kansas Breastfeeding Coalition. I really think the Kansas Breastfeeding Coalition could be the poster child for this project that the USBC and the CDC envisioned 6 years ago. The KBC did not exist 6 years ago, and I look back on where we started, which was with nothing, and where we are now, which is handling multiple programs and projects, multiple grants and contracts, and I really attribute it to the support that we received from the webinars. The webinars were really instrumental in giving us ideas, but I think more importantly, it gave us inspiration. so often, especially in the early days, we felt very much alone. I think a lot of people working in the advocacy for breastfeeding arena, you often feel like you're the only one speaking up for breastfeeding. And it was refreshing every other month to listen in and hear of others around the country that were addressing the same things that we were addressing, having the same challenges, but more importantly, finding out what they were doing to address it. So it was inspirational and refreshing to feel a part of something bigger, to feel that you weren't alone in just your state or in your health department or even in your local coalition, that you were truly a part of something bigger. And I think along with the inspiration came the relationships. There really isn't anything that we're doing in Kansas that we didn't learn from someone else. I think Tina is like my mentor. Indiana is Kansas' big sister. We have learned so much from Tina's work and from others around the country. And a lot of it started with the webinars. Some of it was at the national coalitions conferences that have occurred over the years. But the idea that we met people and we found our resources so that when we were ready to embark on a project, we had in mind someone that we could contact who had already done that, in many cases multiple people. And invariably, everyone was willing to share their ideas, their experience, their materials in many cases. Again, Indiana helped us with our child care provider project and was very generous with their projects and materials. And this was true with other coalitions as well. So we found our resources, we found our people through networking, and these webinars were really a great way to do that, and also to hear what was happening on the national stage. And I like to say now that we're able to do somewhat what they're doing in Indiana. We've built a little over 20 local coalitions here in Kansas. And so now we're in the position as a state coalition to be able to foster those coalitions, to grow new ones, and then to be a conduit of information on these webinars when we hear from the CDC on what national trends or projects are coming out. The state coalition, we're now in a position to be able to be a conduit of information to these local coalitions and get that information out to them, and even in certain areas pinpoint it and target it to the needs of those local coalitions and communities that we're getting to know so well, and getting the right resources into the right communities that are needing that. So it's really been very inspirational for us and extremely helpful to be able to keep a pulse, if you will, on both the national stage as well as what's happening with other state coalitions. So I'm extremely appreciative. I feel that USBC and the CDC have given us our wings, and we are growing and thriving because of the help that we've received. So I really want to express our appreciation to the webinars, to the coalitions conferences, and all the help that you've given us in between as well. And now we want to give back and help other coalitions. If there are people on the phone listening that are considering a project, I've listed on our slide the projects that we're working on. We are more than happy to share our resources and materials about any of those projects and give forward whatever we can. So thank you very much for having me on this call and allowing me to reflect on how important these calls have been to us.
Thank you so much, Brenda, and I hope you will all take Brenda up on that, because she really shares with such a spirit of generosity. There is not one grant proposal that she's written that she hasn't shared with coalitions in her region or across the nation. She sends us the things that she's written. She's been diversifying the streams of funding for a coalition, exploring many different options, and she's always willing to tell us about the lessons learned. So thank you again very much, Brenda. It's all about relationships, as you said. Well, our next speaker is, we are honoring Charlene Burnett, who is just such a wonderful leader and mentor in, I think I've lost my page, in the field of breastfeeding, and she could not be with us today because she has to be with her family, and she asked me to share these thoughts. As you know, Charlene has worked at the Uzazi Village and also with the Missouri Breastfeeding Coalition. So I'm going to read this out in Charlene's words. She says, I would like to share how important the USBC has been to uniting and supporting the coalitions. 10 years ago, we didn't know what great work our neighbors were doing. We had no knowledge of how to support each other. USBC was the catalyst for opening doors and sharing support statewide, region-wide, and helping breastfeeding become a national level topic. And that carries over to this day in my work at the Uzazi as the peer-to-peer support program. Charlene, and I also wanted to say, Charlene also wanted to mention a very specific person. She says that she mentioned the 2004 Office of Women's Health media campaign. Dr. Suzanne Hayes at OWH nurtured a community of national leaders that included grassroots community organizers, state health departments, and national leaders who were all empowered to be innovative with media messaging and outreach. And there was a big emphasis on reducing breastfeeding disparities. And so Charlene says, for the coalition folks who were involved in this OWH campaign, this was the tipping point for us to be doing something on a national level. And so Charlene says, I want to thank Dr. Hayes for her efforts, that the first one that brought us together nationally to be supporters. And thank you, Charlene, for your thoughts. Our thoughts are with you, and we will have her soon for a webinar presentation of all the work she's been doing. And with that, I'm going to move on to our final voices from the coalition. We're delighted to introduce Dr. Sahira Long. Dr. Long is a board-certified pediatrician and lactation consultant. She's a graduate of the George Washington University School of Medicine, and she's an assistant professor of pediatrics there. She's a medical director for 2 children's health centers in the medically underserved Southeast Washington, D.C. and Children's National East of the River Lactation Support Center. She has served as the president of the DC Breastfeeding Coalition since its inception in 2004 and currently serves on the board of the directors for ROSE, Reaching Our Sisters Everywhere, and also on the Academy of Breastfeeding Medicine. Sahira has been involved in breastfeeding advocacy on the national, state, and local level. She participated as a panelist during the U.S. Surgeon General's call to action to support breastfeeding and is featured as an expert on the Office of Women's Health, It's Only Natural campaign to improve breastfeeding rates among African Americans. She blogs for Moms Rising on breastfeeding-related issues. And we are so glad to have our partnership with Sahira Long. She has been a leader way ahead of her times. For so many years, her coalition has emphasized the importance of community partnerships and community connections and has made eliminating health disparities their focus. And she's also been so persistent in making sure that in her role as a mentor and professor, that her students learn about breastfeeding. When she isn't busy doing all the things that she does in her professional life, she's an avid gardener and loves traveling, baking, and spending time with her husband and 2 sons. And with that, I'm going to turn it over to Sahira. Welcome, Sahira.
Thank you, Kenny. Can you guys hear me?
Yes.
I don't know how to. Okay. Thanks, Kenny. That was a great introduction, and I'm really honored to be here and present. I'm going to try to catch us up some since I know we had that technical glitch, but I couldn't miss up the opportunity when Kenny asked me to share what these webinars and the times that USBC has gathered us as coalitions has meant to me on behalf of the DC Breastfeeding Coalition. And I am, or used to be, a pretty avid David Letterman watcher until, of course, I had way too many hats to wear and can't stay up that late to watch them. So in the spirit of David Letterman, I'm going to go through my top 10 reasons to participate in USBC and CDC-sponsored state breastfeeding coalition events. Next slide, please. All right, so drum roll, please. Number 10, this is a tribute to the hotel that the conferences were at. back before we were too big for it, but the cookies at the DoubleTree are the best. So that's number 10. Number 9, you get better social networking than Twitter and Facebook. Who can say that they have friends from across the United States that they've actually met in person, not just on Twitter? Number 8, getting excused from work to attend a CDC conference call. Talk about how official that sounds every 2 months. Number 7, and this was something that's been touched on by everyone else that's spoken before me, hearing ideas for the next breastfeeding project your state can try. Webinars and the conferences have just inspired DC from where we were 10 years ago to where we are now, to just keep reaching for new things and never settle for where we are. Number 6 is coming. The USBC Power Tools series, if you can get off every month to attend those have been great. I personally can't get off every month to attend them, so if USBC is listening and can potentially archive those and put them on the website, that would be wonderful for those of us who can't attend in person. And number 5, the USBC and CDC announcements that come at the end of the coalition's webinars every 2 months definitely keep you in the know and can help prepare you to take action. So knowing what's coming before it happens has always kept us ahead of the game in DC. And I think Brenda said it best, breastfeeding advocates are always willing to share resources your coalition needs. So not only hear ideas, but we're just a giving group of people. It's not turf wars or anything like that. So anything that you hear folks doing, they're always willing to share how they did it and what they learned. And DC just launched a campaign working with our hospitals, and literally the Delaware State Coalition sent us links to everything they created for their own campaign and let us tweak it and take it and run with it. So really appreciate the willingness of everyone to share what they do. Number 3, and this was also said, I was wondering if y'all saw my slides, but being surrounded by people who understand and are just as passionate about breastfeeding as you, it definitely does feel kind of lonely if you're alone and don't realize how many people are just as passionate, and to not feel like you're the only one that cares this much about breastfeeding is great. Number 2, so getting advance notices for upcoming breastfeeding related grants. DC has been able to position itself when we come on these calls and hear about things that are coming from CDC through the state health department especially. We've been able to put ourselves in connection with the folks that we need to be in connection with to be able to take advantage of them, because not a lot of grants will come that are specifically for the coalition, but you have to work in partnership with your state health department. And so knowing that it's coming has definitely helped us. And then number 1, the CDC breastfeeding group is even better than the DoubleTree cookies. It's one thing to put your money behind what we're doing as a group of coalitions, but it's another thing to be available and willing to help the coalitions to do what they do. Personally, we've had to reach out to Carol and Kelly and the rest of the team to get data that isn't necessarily ready to go on the website yet, or resources for conferences that we've done, and they won't just let you know where to find it. They'll send it to you. They are just super helpful, and we couldn't do what we do without them. So that's my top 10, and the last slide, I'll end it with thanks to USBC and CDC. We definitely couldn't do the work that we do across the United States and the states and territories without you.
Thank you, Sarah. That was really fun. I think you've just given me the idea to do top 10 more often for our other events and conferences as well. So thank you very much, Sarah. And now moving on, I'd like to introduce our final speaker, who is the Executive Director of the U.S. Breastfeeding Committee, Megan Renner. I have great pleasure in introducing Megan. She has been working with the USBC since 2004, and she previously served as ED of the Institute of Management Consultants USA and the Museum Trustee Association, and as Deputy Director and COO of Lamar's International. Best things about Megan is that you need a different kind of mindset to be a coalition leader, and from having whiz skills in political savviness, management, governance, and from all her technological things, she's really been able to take us to that next leap forward, and we are so lucky to be a team working at this great organization. So I'm going to turn it over to Megan.
Wonderful. Thank you, Kinkenny. So you can go ahead to the next slide, and thank you to that great introduction. And wow, what an honor and an amazement it is to me to be here. Just last month was my 10-year anniversary with USBC, and it's our 50th Coalitions webinar. And I swear I about fell off my chair when I heard Kelly say that as we do the 50th anniversary of the 222 calls, we have just reached 222 baby-friendly hospitals. How cool is that? So I'll be very brief here, but just say a few words of closing and highlights of the USBC's perspective of the last several years of our coalition support work. And of course, many of you know that this really all began with that 2006 conference, the very first coalitions conference funded by CDC and supported also by several of our other federal partners. And that really launched us off. That was the point where we began to build our online directory of state coalitions and keep track of where they were, keep track of registering the 3 leaders per state that we've kept a database of ever since. Those 3 leaders then became the basis for the Coalition's electronic forum that we started in 2007 as a networking and sharing space online. And of course, the 222 calls began back then. You can see some of the key presentations from this early period. So Kinkenny, you can go to the next slide. And of course, the 2006 and 2008 conference, the key thing that changed between those, of course, 2006 was the first ever focused on the state coalitions, and then in 2008 we added territorial to the name and began to also reach out to the U.S. territories. Next slide, please. And then 2009 to 2012, that was really the period where we really solidified and built a stronger relationship with the coalitions, beginning out of the creation of our strategic plan. And in late 2008, early 2009, we created the coalition's regional rep structure, at first as a mechanism to really gather deeper input and engagement from all of you into that strategic plan. Shortly thereafter, we decided to keep it and to support it even further with the regional networking calls, listservs, and ultimately in 2011, it became an official member category of USBC with voting rights and all of the trappings that comes with. And then it was also in 2010 that we shifted the 222 series to webinar format. So, if you go back into the early years, you'll see it's MP3 audio-only archives. From 2010 on, it became both the video, the view, and the audio. And you can see some of the key presentations that we highlighted from that period. Next slide, please. Just a couple of really key outside developments that happened that have affected all of us. Of course, in 2010, we had the Affordable Care Act, and highlighted here the major breastfeeding provisions. Of course, there were many, many other things that have affected the landscape of breastfeeding out of the Affordable Care Act, but these were the 2 most direct. Next slide. And then in 2011, the Surgeon General's call happened, and you'll see, and you have heard much from us since then, highlighting especially Action 20 around public health infrastructure, which specifically calls out and identifies both USBC and the state breastfeeding coalitions as leaders in its implementation. So this was a key turning point for all of us. If you go to the next slide, you see the 2010 and 2012 conferences. In 2010, we added in the tribal coalitions formally into the name and also had our very first advocacy day. And you'll remember in 2011, we launched National Breastfeeding Month. So same year as the Surgeon General's call, that really was a big year, and we often talked about 2011 as the tidal wave or the tsunami of breastfeeding activity really launching during that year. So we were very excited in 2012. The Coalition's conference theme was, of course, answering that call that we have done with all of you. Next slide. So as we answered that call, we've really been able to do so much thinking and connection and learning. As Tina was saying, it's such an honor to be part of this learning community with all of you and a community of practice with all of you, building and growing the power and potential of breastfeeding coalitions. And these are just a few of our highlights of how coalitions have really made an impact and where we've really been thinking and expanding our approach. Next slide. And then in 2013 really was a key turning point here, because with our Kellogg Foundation grant, we hired Kim Kinney, who you all now know very well as our Coalitions Relations Manager, and she has then conducted the needs assessment on the grand scale, more than we were ever able to do before, and has used that data to identify and map measures of coalition development. And also now has built a matrix tool that will be a fabulous tool for the state coalitions and other coalitions as well, providing both a dashboard snapshot and an ongoing self-assessment and planning tool. So we hope you'll be just as in love with this tool as we are and able to use it in many different ways for the years to come. Next slide. And then just this past year, the Power Tools webinar series was launched, of course, dedicated to coalition capacity building. And it is archived. I want to make sure folks know it is up on our YouTube channel, all of the videos. So I'll do a quick flash of the link to that in just a moment. And then this year, we've also had the great pleasure to hire Danae to our team, a Coalitions Relations Coordinator, to support King Kinney in all of this great stuff that she's been able to do. And the new work that Danae and King Kinney are starting this fall has been around organizing the state coalitions into learning cohorts based on the developmental stages, as we've talked about many times. In different coalitions are in different places, and sometimes they take a few steps forward and a few steps back, and that's all part of the process. So having this more customized and aligned technical assistance and training offerings, we really think will take our coalition support to the next level. No more one-size-fits-all. We really want to be able to meet you where you're at and where each individual coalition is at each time. So this will result in a plan for learning collaboratives that would be hosted regionally. Of course, future funding pending according to the CDC and the federal appropriations mechanisms, but we're very excited about that opportunity to be able to see you more often and regionally as opposed to just every other year in DC. Finally, as King Kinney is showing here, we also in August launched our brand new USBC Vision, Mission, Values, and Strategic Framework. There's an entire webinar that we could do about this, and we already have, so I encourage you, if you did not listen in to the Power Tools webinar in September, it is archived up on the website. The link to YouTube is there, and it has a whole wealth of information about this vision, mission, and new strategic framework. So do encourage folks to check out that recording. Next slide. And of course, we just had our 5th Coalitions Conference, and you'll notice, and we've probably many of you are aware that we changed the name yet again and took out the state, territorial, tribal to really make that event inclusive of all levels, all types of breastfeeding coalitions, geographic, cultural, across the board. So we were very pleased to have that and to have such a widely diverse audience this year. Of course, racial equity was also a new objective this year, but not a one-time focus. Of course, has been added to the objective for the series of the conferences, and we will continue to expand and support the coalition's commitment to racial equity and diversity and inclusion through the coming years. I think the next slide is my last, but I do want to highlight very quickly one thing about this. So in 2015 and beyond, just in the new year, we will be launching our new website platform that will include the new and improved Coalitions Forum. Will be renamed the Coalitions Connection. And there will be networking and sharing space for all the coalitions to come together, as well as for each individual state coalition, and territorial and tribal as well. So we will be having much to talk to you about. Both Kinkini and Danae will be in touch with you about the website spaces and how to utilize those. The second component here, though, I want to just highlight as well, because the Breastfeeding Action Directory, as Brenda was talking about how amazing it has been to learn from each other and refer to other projects that other coalitions or other entities are doing around the country, this action directory is really going to be the nuclear option for that, and we are so excited about it and want to encourage all of you to be ready to be entering your information about your projects into your directory profiles when we launch in January. It will be such an amazing tool to sort and sift and display similar actions on topic areas across the board. So we're really looking forward to this, taking that to a whole new level with the benefit of technology. And then lastly, we'll be looking forward to using some of our wonderful work around the coalition measures and indicators to add a new indicator to the CDC breastfeeding report card in the future. You may have noticed that we've had them in the past, and then they've changed over time, but we'll be able to support the CDC in having a deeper, more meaningful measure in the future. So looking forward to that as well. So thank you again. It has been an amazing honor to be with all of you and to be continuing to learn and grow our coalitions. So thank you, everyone, and back to you, Kinkini.
Thank you, Megan. And that brings us to the end of today's session. Thank you very much to our speakers, and we learned so many ways that we could connect. And as Megan said, that we will be doing a lot of new coalition capacity building support, and we invite you to be really involved in the training and support and the communities that are going to be coming in the new year, and utilize the web platform to build your own communities for coordinated action. So thanks for all you do to improve the lives of women, children, and families. For the regional call participants, you will now move on to your regional meetings. And for all the others, goodbye for now, and I look forward to having you for our next webinar session in 2015. Thank you very much.